Hey everybody, we're live here at Bonheur Children's Hospital in Memphis, Tennessee. Thanks for joining us. We appreciate you joining our Facebook Live event, and we're going to get started in just a second with our guest. And please let us know if you can hear us, if comment in the section of the audio sounds okay, and we can adjust it. We are in the exercise lab here at Bonheur. We're with one of our experts, and I'm really excited to hear what he has to say. I'm Sarah Burnett. I work here at Bonheur in communications, but I have 3 girls who are very active in sports. I think we've played everything under the sun, so volleyball, basketball, track, swimming, cheerleading, all those things. So I'm excited to hear what Dr. Arevalo has to say. And let me tell you a little bit about him. This is Dr. Alex Arevalo. He is a exercise and sports cardiology expert here at Bonheur. He's from Florida originally. We recruited him here about 8 years ago, and the best part is he and his wife Megan have twins. They're 14 months old, girl and boy, and they're adorable. So he's got lots of sports in his future as well. So we're going to talk for about 30 minutes about exercise, sports, heart health, what to do, get his insight on common issues, and just hear from you with your questions. So we're really looking forward to this discussion. So please ask your questions in the comment section. So welcome, Dr. Arevalo.
Thank you guys for having me here. I'm glad and happy to speak. Sports and exercise is a passion of mine. I really enjoy helping kids being active and exercise. So I'm happy to be here and talk and field any questions. Please send your questions your way.
Great. And if we don't get to them right away tonight, if we have a lot coming in, we'll make sure that somebody follows up with you from our cardiology team later. So Let's get started. So we all have watched the news, and as moms, we have to sign a sudden cardiac death form, like when we do our sports physicals at the beginning of the year. And we've seen the news about tragedies that have happened with children. Can you kind of tell us about that form? What does it do? What is it looking for? And just kind of what should we know about it?
Yeah. So it talks about screening. So I think screening our athletes for heart disease is one of the main questions in there. And screening has been a big question in medicine lately. We really don't know what the best screening modality is. I mean, in the United States, we really want kids to be screened at least by history and physical exams, really talking to them and examining them. A question has always been, should we add an EKG? And we're really unsure about that. I think that's one of the forefronts. I think when we talk about the new form, the sudden cardiac death form, it's just bringing awareness. I think the fact that these symptoms can happen to anybody, and I think that we want the parents, the coaches, the athletes to be aware of what to look for. I think commonly parents are like, well, what should concern us? And this is what that form's about. And I think it's not just for parents, but for athletes, but for coaches and trainers and pediatricians and primary care docs.
That's great. So it's about awareness. That's really good to know. As a mom, that's important for me to know. And you mentioned it's important to know the signs and symptoms. So can you tell us a little bit about potential heart problems, maybe what to look for?
Sure, definitely. So there's 5 things when we talk about. When we ask athletes, like, what are they feeling? One of the most important ones is, have they felt lightheadedness or passing out with exercise? That's probably the number one thing, that if you're feeling lightheadedness or if you're passing out during exercise, that probably has about a 50% chance of actually having some type of heart disease.
Oh, wow.
The other things that we ask for is, are they having chest pain? Are they feeling that their heart's going fast? Are they feeling that they're getting more tired than other kids that they're doing? Those are probably some of the top questions into it. We always like to talk about family. Has anybody died suddenly under the age of 35? That was an interesting study that talked about that people that died under 35 in sporting events, it was more likely to be some type of disease that they were born with, especially a heart disease. If they were born over 35, you started thinking more about wear and tear disease, so like atherosclerotic disease, heart attacks, MIs, strokes, and so forth. So those are some of the top things. When we examine kids, we really look for heart murmurs, so the ability that we're hearing the blood going through their heart, unusual blood pressure abnormalities, or if their pulse is abnormal.
And so the symptoms, that's really helpful. And you just, when you say you want to talk to your coach, talk to your doctor, ask. As a parent, I know I'm the best advocate for my girls, so is that what you would recommend? Just talk to your coaches, talk to your physician.
Yeah,
just ask those questions.
Definitely, because I think what we see in our clinic that lots of kids have chest pain. Lots of kids are feeling that their heart's going faster. The question is it truly a heart disease? Most of the time it isn't. Most of the time it can be just a normal kind of adaptation to exercise, and it doesn't have to be something abnormal. So I think we can leave that reassurance, because I think as heart doctors we want kids to be exercising. And that's our main goal, for kids to be going active, running around, playing, causing chaos.
Twins will do that too, right?
Twins will definitely do that.
I hope your wife is watching tonight, but I bet she's putting them to bed.
It's a 50-50.
I think we have some questions rolling in. So we're here in the exercise lab. Can you tell us about some of the tests you use to help diagnose or rule out problems? I know you've got a lot of equipment here in this room.
Yeah, so very commonly we get asked, what tests can we do? As cardiologists, we have two major type of tests when we look at the heart. One is looking at the electricity portion of it, one is looking at the plumbing portion. The most effective, efficient test, it tends to be an EKG, okay?
Which is what?
So we actually had somebody print out an EKG.
What does EKG stand for?
So that's an electrocardiogram, okay? So it's 12 different camera angles of the same electricity going through your heart, okay? And when you look at it, there's a little mountain, there's a spike, and there's kind of a bigger mountain. So what you're seeing is usually the energy going through the heart from the top chamber to the bottom chamber and resetting. This is a great way to look at the electricity of the heart. It can give you an idea if the heart chambers or the actual plumbing is different, but it's not the best way. And that's what's always concerning, because currently what we know about the things that are hurting kids in teenage years or early 20s, it tends to be more plumbing issues. And that's why we think that the EKG may not be the most modality.
And what do you mean by plumbing issues?
Plumbing issues. So when we look at the plumbing issue, we're actually looking at the heart structure.
Like the structure of the heart.
Right. So the heart has 4 valves and has 4 chambers. So we're making sure that everything's connected well and that the valves are opening and closing well, the pumps are squeezing and relaxing well. Over here we actually have one of our ultrasound, so you can see that we try to make sure that we have 4 chambers, that the blood is moving appropriately through the heart into it, that it's being pumped effectively into it, and that there's no extra vessels or extra holes that could account for any of these signs or symptoms that we tend to hear about it.
Okay, great. We have a question from somebody. This is from Talia. She wants to know what specific examinations and or questions should be investigated during a sports physical and primary care.
Yeah, so they do make some recommended questions, which in general can be those 5 major history questions: passing out, chest pain, feeling that your heart's racing, feeling that you're getting excessively tired during fatigue, atypical seizures into it. Do they have a family history, and do they have any things on physical exam that will suggest any heart diseases? And one of them is murmur. We get commonly asked, what is a murmur? And it's just the ability for us to hear the blood going through somebody's heart. It doesn't have to mean it's abnormal, but it can be. So sometimes you need somebody with some level of expertise to feel that and to listen to it and see if you need to do any further testing, like an ultrasound.
Makes sense. That's good. We have another question from somebody. Thank you. This is, how is new technology changing the way we test and treat kids? And then what's on the horizon?
Okay.
That's a good question.
Yeah, very good question. I think in the first front, ultrasound is getting better. One thing that hurts young people tends to be muscle disease, heart muscle disease. So we call those cardiomyopathies. So we really try to look not only how the heart is squeezing, but the heart is relaxing. So ultrasound is getting better at detecting that the heart muscle relaxation properties, and we're getting better and better idea of how to detect and how to be awareness, and that's some of the things that are coming with the ultrasound technology. MRI, cardiac MRI is becoming a big forefront at looking at heart muscle disease. It can look at scarring, which is really there's no other good way to look at it other than this way, and it's non-invasive. I mean, you have to be still for about an hour to do it, but it can get some really good idea of what the heart muscle looks like, if there's any scarring, how it works, at least at some of the generalized functions.
That's fascinating. It's interesting how far the technology's come. I know it's helped you a lot.
Yeah.
This is from Laura. Are there any sports, like impact sports, that a child who has had open heart surgery should avoid when they're older?
So definitely a good question. There's 2 off the top of my head and 3 that's.
I bet you get this question a lot, don't you, too?
Hot topic. I mean, a lot of these we see in our clinic into it. Kids that have looser skin, like Marfan's kids, those kids with high impact sports can stretch and they can tear, especially the vessel that's coming out of the heart, the aorta. So in general, we really think that kids that have Marfan syndrome or that have a real mixed connective tissue disorder, they probably shouldn't be exercising with high impact sports. They can also damage their eyes. They can have some of their lenses dislocated, and they can have some vision problems from that. The second one's blood thinners. Blood thinners tends to be a big thing when you're someone that's going to be exercising and is going to have a big blow. We're talking about martial arts type of sports. We're talking about wrestling. We're talking about football. We're talking about soccer. Basketball has some level of impact. But blood thinners, especially kids that have valve disorders. ICDs, or people that have had pacemakers or defibrillators, is a hot topic. I mean, most of the data actually says that they're pretty safe to exercise, but there's a level of comfort with their electrophysiologist or the doctors that really look at their electricity to answer that question.
They have to be careful with the contact, I would think.
Yeah, I mean, some of it was dealing with moving some of the leads that they put or some of the wires that they're putting in there, but the data is coming out now that they're more on the safe side than the dangerous side from themselves.
And you were telling me, I thought it was really interesting when we were talking about doing this, you were telling me that the relationship with your physician is so important, to have these discussions.
Yeah.
That's really a key component.
I think when I meet people and kids and athletes that are active, that had heart surgery, a lot of it's very individualized. I think there's a relationship with the patient, and there's a trust on both sides. So sometimes I meet kids that have had 2 heart surgeries or 3 heart surgeries, and they have complex heart disease, and they're like, what can I do? And I'll say, okay, why don't we work on these things and see how you're doing? And there's a level of trust that I expect them to tell me, hey, that was too much or too little, so I can kind of adjust that relationship with them, and vice versa. He has to be able to trust that I'm kind of figuring out what's the best for him.
Watching out for their best interest, yeah.
For sure.
That's good. All right, we have another question. How high can your heart rate go with exercise normally?
So the average heart rate tends to be about 220 minus your age. Now that's a prediction.
Wait, say it again. 220 minus
220 minus your age. So I'm 38. So somewhere in the 180s should be my top speed. So a lot of times when you can wear a heart rate monitor and you can actually figure out that actual number, but it's a good number to know, because a lot of times kids will come to our clinics and they're like, hey, Dr. Alex, my heart rate was 130. I just came off from PE, or I was doing a class. I was really worried. And the thing is that may be in the normal range. It may not, but it may be in the normal range, and that's something else. Compared to the kid that says, hey, I came off from PE and my heart was 230 or 240. And so that passes that rule of thumb. So a lot of times we're like, we really have to kind of figure this out. This could be an electrical disorder. We may have to tease this out. We may have to have an electrician see you into it.
You call them electricians, but the heart specialists. Yeah.
Electrophysiologists, yes.
Of plumbers and electricians, right?
Plumbers and electricians. That's why I kind of phase it out.
That's good. And so as a mom, I need to make sure that my daughters know what their heart rate should be, right? I mean, that's a good thing for them to teach them to look for themselves, to take care of themselves as they grow. Yeah,
I mean, I think that I tend now to have a heart rate monitor, just because I get so much, hey, out.
On your
yep.
That
So
kind of thing.
My heart rate now is 59. So
and is that good? That's good.
That's perfect.
Okay.
That's awesome.
Good.
So a lot of times people are like, hey, my heart rate was on the low side, was on the fast side. Your heart's very dynamic. Okay, so your heart reacts to whatever you're doing. So if you're stressed out, it could be 100. If you're relaxed, it could be 50. I mean, I think that's some of that relaxation property that we were talking about. We had a kid that he came and he was a golfer. I think we had Jordan Spieth in the Masters, and he said, hey, I missed a shot because I couldn't relax enough. I couldn't take a deep breath. And that probably means he couldn't get himself to relax. He couldn't get his heart rate low enough. He couldn't get his body and his mind to really get to what he wanted to do. And so that's an important factor.
It seems like there's so much more awareness now with all the bands that everybody wears of your heart rate and what it is, and of exercise, even from when I was growing up. We didn't know any of that stuff, and now I feel like all my kids, they all have the thing and want to know. And
yeah, I think it's twofold. I think it adds value because a lot of people, it makes you aware, like, oh, I haven't been exercising that much, or it's in there. On the other side, there's actually some artifact. So a lot of times it misreads it. So a lot of times it's like, oh, my heart rate says it's only 80 and I'm really exercising. I should be pushing it. And we've tested some people in our lab and their heart rate isn't what their monitor is. So especially when they get their heart rates really fast, these monitors aren't that great. And that's some of the data that's coming out with most monitors. In general, these monitors that you can have, the wrist monitors or the strap monitors, the strap monitors definitely can pick it up a little bit better, but it doesn't, it's a little bit more annoying to be wearing this,
right. You wouldn't wear it all the time.
Through your work day.
Right. Okay, we have another question. Okay, to follow up, how can my child check their heart rate without a monitor?
Yeah.
So how do you do that? That's a good question. So if you don't have the band, how do you check your heart rate?
Yeah. So the practical way is to feel a pulse, and so this is your thumb. You can kind of feel down, and you can press down, and you would feel your radial pulse, and you can feel it, and you can see your heart beating, and you count it for about 6 seconds. So you count how many times you beat for 6 seconds, you multiply some 10, and that's your heart rate in there. You can also feel it in your neck. You don't want to press both sides because you may pass out, but you just want to press one side. And those are probably the most practical. I'll tell you that some of it gets a little bit harder to do that. Some people, if they know they have a heart condition, they may get a stethoscope and just to sound it out a little bit easier. Some of us will do that. I mean, I'll tell you that most times when it's really abnormal, it's too fast to count. I mean, they're like, I'm trying to count, and they're like, it's, and so they can't count
Can't
out
keep
that.
up with it.
And that's usually those things that you're like, that we probably really should get that person in and check them out.
Okay, that makes sense.
Yeah.
That's good. Okay, here's another question from Jennifer. Okay, you may have to interpret this. How often do patients with HLHS that are post-Fontan have to have additional surgeries later in life? So you'll have to translate some of that for
so
us.
hypoplastic left heart.
Okay.
So heart conditions are about 1 in 100 per patient. So 1 in 100 kids are born with a heart condition. About 10%, 1 in 1,000 actually need heart surgery. And there's some that are more simple, and there's some that are more complex. I would say the hypoplastic left heart is probably our hardest or one of our most complex kids. It's kind of like the pinnacle for us to really help these kids. And it's not just doing surgery when they're little. So a lot of these kids need 3 heart surgeries in the first 3 years of their life. But they expand, and they may need especially valve surgeries, or they may need what we call conduit surgeries later on. But they're at risk for much more. They're at risk, since they only have one pump, we have to send their blood to their lungs through a different route. And so they're at risk for having electrical disorders. They're at risk for having liver dysfunction. Their stomachs may not work well. So you really need specialists. I think at Bonheur, we're pretty lucky. We have Dr. Waller, and he's an accredited ACHC cardiologist, and he really looks after this. And this is probably one of the diseases that you really have to watch out for. We, in general, like to think that they're only going to need 3 surgeries early on, but not uncommon that they actually need another 1 or 2 surgeries in their lifetime.
And you mentioned Dr. Waller. A lot of these kids are growing into adulthood, and so I know, has been tracking adults as they grow with their congenital heart defects.
I mean, so in pediatric cardiology, they started a new accreditation really for cardiologists. Because this is important. There's more adults with congenital heart disease than there's pediatric patients with congenital heart disease. So these kids are growing up, and although our adults cardiologists know a lot, kids that are born with heart conditions have different factors that leads into. I mean, they have insurance things, they have different behavioral things, they have different things that they're dealing with. I mean, that their level of activity is differently.
Their heart is structured differently.
Yeah.
Totally right.
And you really have to have a really understanding to really help these kids and their families.
That's great. All right, we have another question. This is from Stephanie. If and when is a stress test needed in children?
So a very dear question to me. So I work in the exercise lab. I mean, the heart is not just a stable structure. It's a dynamic structure. It's always moving, right? I mean, my heart's going 60 times a minute. And the studies that we talked about, ultrasound and EKG, looks at the heart in a static form or an idle form. I always think of the heart as a car or as a motor. And so these tests look at the heart when it's just sitting still. But you wouldn't buy a car if you would just turn it on. Right. You want to test drive it. So the stress test is a way that we can actually push the heart or stress the heart system out into it. So we at least will check blood pressure, we'll check their heart rate, and we'll see what the electricity is doing as we stress them out. And that's when we can see how fast and how high their heart rate can do, what their blood pressure, and how they're doing. We can also add ultrasound. We can do a stress echocardiogram, and we can also look at how they're handling oxygen. So we can get very complex, and we can look at some of their metabolic demands, which is some of the things that are unique to Bonheur. We actually are one of the only places in this region that are doing clinical cardiopulmonary stress tests for our kids, and it really gives us good information about our heart and lungs with exercise.
So what is the stress test? What's involved And you probably aren't doing this at your sports physical, right? This is kind of down the road.
Yeah, so let's say you have a kid that says, hey, Dr. Alex, I really have been having this chest pain, or I've been feeling bad only with exercise. I can't figure it out. It makes me uncomfortable to exercise. We've done an ultrasound, we've done an EKG, and all that's looking normal. This is one of the things in there. So this is one of our treadmills, actually. Okay. So we have our treadmill. We're usually hooking up an EKG machine. We have them on a blood pressure machine. We have an oxygen sensor. Sometimes we'll actually put this thing that looks like a scuba mask, a headgear, and we're actually seeing how much oxygen they're consuming, how much carbon dioxide they're taking out. And you get graphs like this. So we actually see like what their heart rate response is. We actually look how hard they're breathing with amount of work. We can see what their electricity is doing. So we get a lot of information. This is, we want to see what their symptoms are, what they're having issues when they're exercising. And it's probably the best way. It's in a lab form. We wish we could do it outside. It's a little bit harder to test that way. But this is about as good as it gets when we really want to see the heart and lungs in action.
Kind of gives you the whole picture.
Yeah, but it definitely does.
Right. So let's do another question. Oh, this is a good one. From Brooklyn. How many hours of exercise a day should my 7 and 2-year-olds be getting?
Okay, good question. I would say your 2-year-old, you probably have to keep them down more than anything else. The general recommendation is probably about 150 to 225 minutes per week. Practically speaking, most kids should be exercising most or should be active most days of the week. So let's say from 3 to 5 days of the week, they should have about 30 minutes to an hour that they're actually active, that they're outside, that they're sweating, that they're interacting with their environment. That's what we really want to see. We want kids being active. I mean, we live in a world where a lot of kids are exposed to iPhones, to iPads, to Wii's, to every kind of cool gadget. Our TVs have 3,000 channels that we can watch on curved TVs. And so it's really tempting to sit at home. And not that I don't do that, but you want to balance that out with actually being engaging in the environment and riding your bicycle and playing basketball and having friends. I mean, I get this question about, hey, I hear all these topics about exercising and about sudden death and kids getting hurt playing football and kids getting concussions, and I'm like, I'm scared my kid should be exercising. And I just go, okay, let's say your kid's not exercising. Do you think that what else is going to be doing? Would he be sitting on the couch? These are high school kids, so let's say he's not in playing sports where he's getting coaches, mentorship, friendships, and now he's sitting on the couch. Probably the biggest risk factor in the United States, which is obesity and sedentary behavior. All right, let's say he's not sitting on your couch and he's outside your home. These are kids. These are high school kids, right? They're risk takers. Now you don't even know what they're doing, right? So you can put it out there. What are they going to be doing? Mm-hmm. And that's probably even scarier. With alcoholism, with accidents. The biggest risk to most adolescents or really teenagers is probably accidents, right? And getting into trouble, because they're risk takers by nature. So I think when people say, I don't want to do sports, they're not thinking of the other alternatives. And I think that's an important thing, that when you look at concussions, when you look at all these hot topics, that kind of brings some anxiety to people.
Yeah, but you're right. The benefit kind of outweighs the risk.
Absolutely.
And I guess for little kids too, you're not talking about formal sports necessarily, that you said playing outside and doing all those kind of fun stuff.
Free will play, definitely.
But that's good for kids too. Great. Whoop, I'm dropping questions. How about I give you those? Thank you. This is from Crystal. Oh, this is a good one. What is the youngest age you are able to perform a stress test?
So probably about 5 years. They really have to mentally understand the test. I think when we try to do 4-year-olds, about a quarter of them really understand.
They don't cooperate.
Yeah, I think it's a little bit tough in there. I think about half of 5-year-olds start really getting the stress test, and about most 6-year-olds, but it's still time consuming and challenging. I think we'll definitely do it. We've done it, especially when it really answers the questions into it. A lot of the indications for doing surgery for valves, it deals with how tired they're feeling. If they're really feeling excessively tired, that probably buys them another valve. We take that seriously to do a valve surgery on a 5-year-old or a 6-year-old. And this is a way to kind of put a number to how tired they're really getting.
So you just kind of see the picture, like you said, see the whole picture of what's going on. Great. We have another question Thank you. This is from Robin. If there, you'll have to explain this one to us too. If there has been an ASD repair, is there anything different to look for when playing a sport? So I guess what's an ASD?
Yeah. So again, congenital heart disease, 1%. Atrial septal defects is a hole or communication in the top chamber of the heart. This is about the second, third most common heart condition that we see. When I think about that question, it's a little bit twofold. I've seen like 15-year-olds that come into clinic and we find a hole and they're about to start season and they're like, how quickly can I return back into basketball season? And some debate, and it kind of varies to the interventional cardiologist or the cardiologist that's putting the device in, if they do it from a catheter base, and it's somewhere between 2 to 6 months. So that's the return to play question. If it's heart surgery, it may be between 2 to 6 months as well, but sometimes they can return sooner. Some of the catheter, they're making sure that some of the tissue is grown around that actual device. On the long side is, what about like, let's say they had the heart surgery 10 years ago. What should they be looking at? It really depends on how they're doing. Most of these kids do fantastic. Really, most kids with atrial septal defects after surgery do phenomenal, and we can almost say that we can repair them, and they can live a very normal life, and most kids really do. If they have electrical disorders, if they have high lung pressures, if they have valve disorders, or if they have pump disorders, we may look at them a little bit different and we may modify that, but most kids do. I think heart surgery has come a long way. I think the open heart surgery started in the 50s, and the goal in the 50s was to get them through surgery. The goal is not to get them through surgery. The goal is to make sure that they're active, that they're playful, that they're interactive, that they're going to college. I mean, our expectations is way above and beyond, and we only look to improve that. I think at Bonheur we're very lucky. We have a strong surgical program. We're one of the best 8 in the nation. I think it's something to be very proud of, and I can tell you our heart surgeons stay at that bedside every day, every minute. If you call them, they will be there, because they're not making sure this kid gets through that surgery. They're making sure they're doing fantastic in sports. When they're 15, 16-year-olds that they're going to college, that's what they view. It's in there. It makes it a lot easier as a cardiologist, because that's what I want for my patients. I want my patients to be interactive, causing chaos, running around, hitting home runs, doing tumbles, going all the way through.
That's got to be rewarding to see kids kind of struggle and then go on and do some of these things.
Definitely. I think we have a cardiac kids camp that we have in the summer, and let's say being a young cardiologist, it's great to see all these kids that are teenagers that are interacting with each other, and they have a scar, but they're all playing basketball, and they're swimming, and they're playing volleyball, and they're rock climbing, and they're drawing, and they're laughing and playing, and it kind of makes up for the times that you're here a little bit later at work, and you're not necessarily with your twins.
Right. And he's got work to do after this, too. That's what we learned. He's got some stuff to do after this after we get out of this. This is from Jason. Does Bonheur have a cardiac rehabilitation program?
So we started a rehabilitation program. So this is actually, the idea is that the heart not only needs to be prepped or reset after surgery, but even during surgery. And those are some of the things that we've been working on. It's kind of an offshoot because we first started a good obesity program here at Bonheur Children's Hospital to really help kids engaging into it. And so some of our kids that are obese need some education on how to exercise and that motivation. And Dr. Webb-Smith has been very active in getting these kids involved and having other people to help them with physical therapy, to teach them all the right tools and to follow up with them and talk to them and keep them motivated. And I've been working with him to try to make a program more specific to our kids that have had chronic disorders. I think kids that have had heart surgery, they're more scared, or that we feel that they're more restricted from exercising, but a lot of them can do a lot more. And so we've been really working with him to try to make sure that they're safe to exercise, and a lot of them are. And as we build our transplant program, that's going to be another piece to add, because these kids need to be moving and motivated, and they need to be moving their hearts and their lungs and their blood and their muscle and all these things to really help not just the heart, but every part of the body engage.
And I guess that would scare you to death as a mom. So I guess that's that part of that relationship And that trust that you talked about, that's important.
Yeah, I mean, I always say in my clinic that 4 people have to be comfortable. I have to be comfortable, the parents have to be comfortable, the patient or the athletes has to be comfortable, and anybody else who's involved in their care, if it's their primary care doctor, their trainers, their coaches, because if they're not comfortable, they're limiting that kid or that athlete or that child from being all that they can be in there.
Yeah, that's great. All right, we have another question from Christy. I wondered this too when you mentioned the 15-year-old with the hole in the heart. How common is it to find defects in older kids and teens?
So, interesting question, because when you look at kids that pass away or they have sudden death, most of those kids have heart muscle disorders. They have these things called coronary, or the vessels that feed the heart muscle, electrical disorders. But not most of those kids actually are getting hurt as older kids. They're usually not the kids that we're operating when they're 1, 2, or 3 years old. So they're not the kids that have VSDs or ASDs, even our transpositions or even our single ventricles. They do have a higher risk, but they're usually not the most common thing. Do we find them? Yes, we do, but they're more the rare. I think, and there is a difference of what we find and what actually causes major problems, or especially like death in there. So most kids are safe to exercise. We have to find that right balance into it, and that's a very personal topic that you really have to talk to your cardiologist or your physician. Because for example, we have St. Jude's nearby, so we have kids that have been exposed to cancer and that they have chemotherapies, and that's affected their heart muscle, their lungs, their muscles, and it's affected them. And you have to find that right balance of the amount of exercise they should be doing. But we know exercise is a good thing. We have kids who have sickle cell, so their blood may change a little bit different due to different environments, temperature, dehydration. And you have to have that right balance, not just with your cardiologist, but also with your hematologist or your blood doctor. And you see that with everything, kidney doctors, lung doctors. That relationship with exercise and what they should be doing should be talked about, just about in most clinics.
And I think, to me, that's what's cool about a children's hospital. You've got all those experts there, if you need them, thinking about what you need and what your child might need.
Yeah.
It's reassuring as a mom to me, for sure. This is from Rakisha. Can a child outgrow a murmur, a heart murmur?
Yes. So the answer is yes, but I think we have to kind of really explain what a murmur is. So I'll explain it that a murmur is the ability to hear the blood going through the heart. So in general, when we listen to somebody's heart, we usually just hear the valves closing, lub-dub, 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 and that's actually the valves closing. Sometimes we hear the lub-dub, whoosh, lub-dub, whoosh, and that's actually us hearing the blood going through it. It doesn't necessarily mean that there's something wrong with the heart. Most of the time, it isn't. I mean, in statistics, we find that about half the kids will hear a murmur, or the ability for us to hear the blood going through somebody's heart. Again, only 1 in 100 kids actually have a heart condition. So most of the time, the murmur doesn't mean that there's actually a problem with somebody's heart into it. So they can outgrow the ability to have that murmur because it may have been because they were dehydrated, they were sick, they were anxious. There may have been other reasons we could just hear that blood going through somebody's heart.
And how do you diagnose a heart murmur?
So murmur is usually by listening to it, so usually with a stethoscope. And the best way to kind of find out if there's an actual problem is, let's say it's looking under the hood with an ultrasound or an echocardiogram.
Makes sense. Okay, this is from Tammy. How serious is, you'll have to translate this to, mitral valve regurgitation?
Yeah. So the heart has 4 valves. Okay. So we have the first 2 valves that are actually getting blood from the used up blood to the lungs. It gets reset, and then it sends the blood out through the left side of the heart. And there's the third valve is called the mitral valve. So mitral regurgitation means that the valve is not closing well, and there's some leaking back into it. It probably matters what's causing it, probably more so than anything else. Some of the valve could be leaking because the valve was different when they were born with. So some of instead of having 2 of these things called papillary muscles, or 2 of the foundation structures, there was only 1. Sometimes the little attachments may have been different. Sometimes the valve could be infected. Sometimes the valve could get damaged actually from, let's say, in adult world, from a heart attack. So that's probably the most important of how serious is it. Big picture, a little bit of leaking of the mitral valve can be a normal finding. So it really depends on what caused it, and it can be seen in normal patients.
And what are the symptoms? How do you know you have this?
Mitral regurgitation. Some people may not have 0 symptoms. So some of what we call innocent or benign mitral regurs, really they may not even feel anything. They may be normal acting in there. Some people, if they have really bad leaking, let's say you acquired into, they may feel really tired. Is probably the most common, and they couldn't exercise as well. Mm-hmm. And sometimes when you listen, you may hear the blood backtracking through the heart, so a murmur.
Yeah. Okay. Great. That's interesting. Well, I thought we were getting another question.
No, not yet.
And so, at one point, can you is this can be diagnosed anytime in your life? I mean, it's one of
absolutely, because in the adult world, let's say you've had a heart attack and you've actually, from not sending enough blood to some of the heart muscle, you may have damaged that valve. You can develop it. You can get an infection when you're adult. So it can be at any time.
Not just a childhood thing.
Not just a childhood.
Okay, I think there was some debate if this was the last question or not. So I think it is the last question.
Okay.
So you're doing a good job. This is good. This is from Jake. Are athletes' hearts different from other children's hearts?
Yeah, so very hot topic in there. So with a lot of exercise, the heart muscle adapts differently. And not just exercise, but specifically what type of exercise. What we see is with a lot of weightlifters, we see that the heart muscle tends to be thicker. With a lot of, like, let's say skiers or cyclists, their actual heart chambers actually look bigger. And those are important because a lot of times we look at these hearts and we compare them to kids that are not exercising. We're like, but the heart muscle looks a little bit thicker and the heart muscle looks a little bit bigger, or the heart chambers look a little bit bigger. Is that normal, or is this an adaptation from exercise? But usually there's other signs. I mean, these guys are more elite athletes. They're big exercisers. We can put them in the stress lab and we can see that these kids are exercising for a long period of time compared to their peers, and we can kind of tease that out. And sometimes you really have to kind of put some mindful thought into it. Sometimes we have to use cardiac MRI. That was one of the things that we talked about. Mm-hmm. That really can look at heart muscle, especially for scarring, which can be a very, very big tip-off if it's normal or abnormal.
Okay, great. Well, thank you so much.
Yeah.
You did a great job. And if there were any questions if there are any more questions, we'll make sure that we answer them. Alex or somebody on the cardiac team will make sure that we answer them. So thank you, Dr. Arevalo.
And thank you guys for having me.
You
guys have a good night.
Great job. You can go home to your twins now.
Yes.
Thanks, everybody. Good night.